In the second section of our lecture, Otosclerosis, now we will talk about different types. In this section, we will talk about the 3 different types of otosclerosis, and this includes stapedial otosclerosis, cochlear otosclerosis, and the third type is histologic otosclerosis. First is the stapedial otosclerosis. In this, what happens is there is a fixation of the ossicles, stapes, and this leads to conductive deafness. We have 2 types of deafnesses. One is conductive, in which the conduction of the sound waves is blocked, and the other one is sensory neural hearing loss, in which the auditory nerve is involved and the further communication to the brain and the auditory center is affected. So in this, the fixation of the stapes, this, if you see, this is the footplate of the stapes. If otosclerosis involve the anterior portion, this is the anterior focus. So anterior focus otosclerosis is present. Then the posterior, on the posterior side, if it is present, it's known as the posterior focus otosclerosis of stapes. This is circumferential. The whole plate is involved from the sides. And then this is the biscuit type, if you see the shape, and then there is biscuit type of otosclerosis is present. Then in the 5th type of stapedial otosclerosis, this is the obliterative type. And if you see, it's causing the obliteration of the footplate of the stapes. So all these are the different types of stapedial otosclerosis depending on what site is involved and how is the otosclerosis, what's the appearance of the otosclerosis. So it's anterior focus, posterior focus, circumferential, biscuit type, and then we have the obliterative type of otosclerosis. And there is fixation because of this bony growth on the stapes. It causes fixation of the stapes. Movement or mobility of these ossicles or stapes is very important for conduction of sound from the middle ear to the inner ear. If this stapes is fixed and it's not moving as a result of sound waves, the sound won't go into the inner ear and person won't hear. So this is the conductive type of deafness because of the obstruction, because of inability of the movement of the ossicles, especially the stapes. The other type of otosclerosis is cochlear otosclerosis. As the name shows, it is involving the cochlea of the inner ear. So in this, the region of round window or the other areas in the otic capsule. We already mentioned otic capsule is the bony labyrinth. Bony labyrinth is the portion which is rigid outer part, and it contains cochlea, it contains saccule, utricle, and semicircular canal. So this, in this diagram, if you see, this is the round window. So it's involved the region of the round window here, and this is otosclerotic bone present here. So it's the region of the round window, and this is otosclerotic bone. This is the cochlea. These are the ducts coming out of the cochlea. So this, it's very, very close to the cochlea, and it's known as the cochlear otosclerosis. It may cause sensory, because in the previous slide we saw the stapedial otosclerosis only cause conductive deafness because it is causing obstruction to the movement of the sound waves. But here this also causes sensory neural hearing loss. Why? Because of the liberation of toxic material into the inner ear fluid, and because of that this causes toxicity to the auditory nerve, cochlear nerve, and is because of it's known as ototoxicity, and this can cause sensory neural deafness because the nerve is affected and the transmission of sound waves now to the brain is not proper, and then it can lead to sensory neural deafness. So this is the cochlear otosclerosis. The difference between stapedial and cochlear, that involves the footplate of the stapes, leads to immobility of the stapes and the conductive deafness occur. In this there is sensory neural deafness because of the release of toxic material into the inner ear fluid. So here again, these are the ossicles of the middle ear. This is the stapes, and this is the otosclerotic bone around the stapes, and also around it involves the round window, and then because of that there is involvement of the cochlea and it leads to sensory neural deafness. This is the otosclerotic bone. The third type is the histologic otosclerosis, and this is the type of otosclerosis in which there is no signs and symptoms. Patient is usually asymptomatic. No symptoms are present, and only when histology or microscopy is performed, there are changes that shows otosclerotic changes. So it's asymptomatic type of otosclerosis. Here you can see the otosclerotic bone present here. This is the foci otosclerotic, and then when the histology or is performed on the microscopic appearance or on the microscopic picture, you see otosclerotic changes present. So it's completely asymptomatic type of otosclerosis. So all these three types you saw, they have a difference. In stapedial otosclerotic, stapes is involved, mainly the middle ear. Fixation of the stapes occur, leads to conductive deafness. In the second cochlear type of otosclerosis, inner ear is mainly responsible for any damage to the inner ear, leads to sensory neural type of deafness because of the involvement of the nerve. So here in this we can see in cochlear otosclerosis there is mainly sensory neural type of deafness is present. And then in the third type it's completely asymptomatic. Patient has no symptoms at all. Its condition is only diagnosed when the tissue is removed and it's examined under the microscope. That's the histological type of otosclerosis. So that was all about the types of otosclerosis. Thank you for watching sqadia.com.